there, Megan Jansen here, Employee Wellness Solutions Network. Today we're talking about stretching, and I'm really excited to pick the brain of Rui Saraiva. He's with Stretch Health Canada. Rui, thanks for joining me on a busy day.
Thanks for having me. I appreciate it very much.
You know, I'm pretty excited to talk about this and really how stretching can be powerful for people who work at a desk and people who have what's called repetitive strain, doing the same small movements all the time. So let's get right into it. What is stretch therapy and how does it differ from massage therapy?
Really good question. Why don't we start with the first part of that question, which is what is stretch therapy? The easiest way to describe what it is actually just take you through a quick little example. We call this the fascial stretch therapy finger example. So if you hold up your finger like so, and you take your other finger, and you just push your finger back until you feel that first barrier of resistance. So right where the tissue starts to slow you down, I want you to just take a little glimpse, a little mental snapshot of your range of motion, okay? So that would just be a baseline test. Now what I want you to do is with your other hand, I want you to grasp that finger. I want you to pull the finger towards the ceiling, and then I want you to pull it back into a stretch position. Hold it there for a few seconds. And then we're going to reset back to where we started. Same thing, we're going to grasp, pull towards the ceiling, and we're going to pull it back into a good stretch. And then just reset to where you started. Take that same finger, pull it back, and see if you got a little more range on the second go. Okay, so it's nothing fancy. It's just we're incorporating the joint capsule, we're working with the fascia, and we're incorporating lengthening of the tissue. So I guess in a nutshell, that's what the stretch therapy is. How it differs from massage is that massage is more compression based with a lot of gliding and lotion, whereas the stretch therapy is more focused on lengthening type muscle tissue. And for a lot of people, I find that's sort of the missing piece of their puzzle that they need after exploring a lot of the different modalities. They really just need a good stretch. So usually when they come off our table, we see a big light bulb moment like, wow, that feels great. This is exactly what I just needed all along. So yeah.
Awesome. You mentioned the word fascia. What is fascia?
Another really good question. So fascia is our body's three-dimensional biological fabric that connects everything to everything. If you imagine for a moment, in traditional academia, when we look at muscle groups, we tend to study them in isolated pieces or parts, which is great for learning purposes, but they don't actually function that way. And that's where the disconnect is, because if you want to know how to maximally lengthen a bicep, you know, we can study it by stripping every other muscle on the skeleton. Okay, we know what a bicep does. When these fibers shorten, it flexes the elbow, blah, blah, blah. But again, when we look at fascia and how it integrates all of these muscles together, it's a lot more like sausages on a link, right? We're more, it's more analogous to that than, you know, individual pieces or parts. So a quick example I can give you to kind of demonstrate what fascia is. If you take your forearm, for example, and you just pull the fingers and hand back, you should feel a stretch happening in those forearm muscles, right? Pretty straightforward. We're just taking those muscles into a lengthened position. Now, let's go back to that fascia analogy, those sausages on a link. Let's try to see if we can get a whole band of biological fabric on pull. So what I want you to do, if you can find a piece of wall, take your palm and take your fingers, put it flat against a wall surface, making sure your palm is completely flat, keep the arm straight, and then slowly rotate and turn your body away from that wall, keeping the hand flat, and tell me if it feels a little different.
Yeah, totally. Right through here.
Exactly. So all we've done is that we've taken that entire line of biological fabric, we've just putting the whole thing on pull. That would be an example of a fascial meridian or a fascial line. And in stretch therapy, that's what we're trying to focus on. We're not focusing on individual pieces or parts. We're looking at the body from an integrated whole and how everything connects to everything. And that's just a quick example.
Interesting. Yeah, it's amazing to even these couple of stretches to feel. So let's take it to the workplace. I mean, sedentary behavior, sitting at a desk, it's stressful for the body to be sitting for too long. And with our world as it is, I mean, some people are still remote working from home and will be. Some are back at the workplace, sitting at a desk. How important is stretch therapy for, I mean, it's kind of a loaded question, but for someone who sits at a desk, what can someone do?
It's the most important thing in ever. Or if you're just seated at a desk and you kind of get locked into this sort of flexed,
Yeah.
rounded back posture and your head starts to migrate forward, it can create a lot of problems down the road. And I would say probably 80% of our clients are desk workers. I mean, the vast majority of them. So we see a lot of consistency and patterns with this, tension headaches, migraines, shoulder aches, pains, all sorts of back issues, hip problems. And it's funny because the stretch therapy really just it just opens and unwinds everything. But the important things are obviously, what are they doing outside of the workplace or outside of the stretch therapy session? Part of our treatment plans, we always look at, how do we give them tools, tips, and tricks to make sure they're we could stretch you till, for 5 hours straight, but I can't compete with 40 hours a week of this, Megan. This is really hard to combat. So we're always talking about strategies. How do we modify their activities of daily living? How do we set reminder systems to make sure they're breaking that seated cycle and intermittently throughout the day, standing up, breathing, stretching, opening things back up, grabbing water, walking, something just to kind of get them out of that poor posture. Did you want me to take you through a couple of simple stretches? Fantastic. So we can do a really simple one. Okay, can you see me in my chair here?
Yep.
Okay, so when you're at your desk and if you want to get a good stretch without having to get up and go anywhere, you can just use your chair seated right where you are. So with your hand, you can grab the edge of your chair and that's going to act as a bit of an anchor. And from this position, if you just kind of lean your torso away from that edge, take your free hand, and this is where you can apply a bit of an over and very gently pull your head sort of away from the shoulder. And as soon as you feel that stretch, you can just hang out here. It's really important to breathe too. A lot of people interpret stretch sensation as pain and they'll, so we want to make sure we're not holding our breath and just breathe through it and just hold. And then time, anything 15 to 30 seconds would be ideal. And then same thing, you would just turn, rotate, switch, do the same thing on the other side. You never want to overstretch too. Just a quick little tip. Some people have this idea that, no pain, no gain. And there's some truth to that, but there's a line that we got to draw and understand that, if you cross that boundary too much, you could be doing more damage. So anytime you're doing a stretch, whether you're on our tables or you're at your workplace, we're always trying to find that sweet spot where we feel a deep stretch sensation, but we're not trying to wrench it and yank it and threaten the nervous system because it kind of, it's contraindications of what we're trying to do, essentially. I hope that makes sense.
Yeah, totally. And I also wanted to ask about consistency. I think the consistency piece is probably also important. You just can't go through one stretch therapy session and be, okay. It's something I feel like you have to kind of build into your day, as you were saying, to become a habit. When you start to feel out of balance, out of alignment, stress, sitting for too long, it's great indications to sort of get up and break that stagnation cycle, as you were saying.
Absolutely. The example that I often use, Megan, is, you can't lift the dumbbell once a month and expect to see adequate strength or results. Why? Because you're just not doing it frequently enough to force the body to adapt and to mold and grow. And the same is true for nutrition, to force those tight muscle fibers to lengthen and to stay loose. So I think that's key. Consistency is huge. Absolutely.
And that would probably resonate with people who have some repetitive strain concerns, doing same movements all the time. So we're sort of thinking about a different type of place possibly. But I mean, the consistency of ensuring that you're taking care of yourself is critically important for that population as well.
Absolutely. Yeah. Most of the people that we see are, they're approaching an age where they just want to be able to move better. So absolutely, I couldn't agree more. Just to keep it really short and simple, I think movement is always good medicine. It's really easy to kind of fall off the wagon and just kind of get stagnant and stop moving. But we find over and over again, a body in motion tends to stay in motion. So movement is good medicine. Just keep moving, find strategies and creative ways to remind yourself to stretch, because we all know we need to, we just forget. It's usually there's a behavioral component. So just, that's it. Movement is medicine. Just keep moving.
Love it. Awesome. Thank you so much for your time today.
Thanks, Megan. I appreciate it so much. Thank you.